Good evening and welcome. You're watching NDTV. I'm Rishika Barwa. Joining us as always on this Saturday evening is the AIIMS Director and member of the Government Task Force to fight COVID-19, Dr Randeep Guleria. Sir, appreciate you sparing the time of day to be with us once again. I have to begin by asking you, highest single day spike that we are seeing, not just in India, but there have been over 2 lakh cases that have been reported globally as well. The question, of course, that many are asking is, when is India going to flatten the curve?
I've said before that the flattening of the curve will happen at different times in different areas in India. This is something we've seen even in the United States, that although the cases are increasing tremendously there, the curve has come down significantly as far as New York is concerned, but it's now increasing a lot in the southern states, especially the southern eastern states. And that is happening in certain parts of India also, that the curve is showing a downward trend in certain cities and certain states, but is also, there are new cases occurring in different areas. So we will have this sort of rise and fall phenomena occurring in different parts, and the curve will flatten over the next few months in different parts of the country. And I'm hopeful that gradually then the overall number of cases will come down.
We have an allied question that one of our viewers has asked online, which is India seeing its peak now, or is the worst still yet to come?
So that's a difficult question. I think a lot depends on how our outlook is. If we as citizens are very sincere in maintaining social distancing, in maintaining wearing a mask and hand washing, we may be able to flatten the curve and the downward trend will happen quite quickly. What we've seen in certain cities is that as the lockdown got lifted, people really forgot that there is still COVID-19 happening and we still are in the middle of it, and social distancing was not done, and this led to a resurgence of cases. This is happening globally, and that is why we're still seeing a huge number of cases, despite the fact that a few weeks ago it seemed that in many parts of the world the cases would start coming down.
It's very interesting that you talk about the resurgence, because that brings me to my next question. We are seeing sporadic flare-ups of cases in different parts of the country, as a result of which, there are mini lockdowns that are taking place in different parts of the country. Is lockdown, according to you, the only way at the moment to be able to contain the spread of the virus?
So if we look at what are the mechanisms that we have to contain the spread of the virus or can decrease the number of cases, currently we don't have an effective drug. The vaccine is still some time away. So the treatment or the mechanisms we have are what we call non-pharmacological means. And here the social distancing and isolation becomes very, very important. If we are able to follow that, then we don't need to have an aggressive lockdown. But if there are parts of the city or areas where this is not being done, then there is no other option but to have some sort of a lockdown in those areas, because otherwise there will be a huge increase in number of cases, not only in that area, but in the surrounding areas as people go to these other areas and are having mild symptoms or asymptomatic, and that is a worrying thing that can happen.
Doctor, you've said this before on the show as well, that, one can assume that there are, community transmission that is taking place, or there's community transmission that's taking place in selective hotspots area. These areas that are going into mini lockdowns now for a period of a week or 10 days, or some are seeing extensions. Uttar Pradesh is seeing, a 3-day lockdown, for instance. Can we then assume that there is evidence of community transmission in these areas?
So in these areas where we're seeing a huge spike of cases, where lockdown is becoming important, especially in these containment zones, there is some suspicion or some suggestion that a local transmission is happening there. It's an issue of what terminology you want to use. But to prevent that, we have to be able to have some sort of a lockdown or a containment policy, so that people stay at home, they don't mix, and they don't go out of that area, so that the infection is controlled and we don't have a huge number of cases suddenly coming from that area.
The World Health Organization, after several scientists raised this issue, have also said that, the virus could possibly be transmitted, via the air. Now, what more precautions do we need to take if we are assuming that coronavirus is in fact airborne?
So I think it's important to understand what we mean by airborne and what do we mean by the droplet infections, and then therefore be able to put it in perspective what precautions we need to take. If we look at what we were talking in the past, predominantly because the virus, when we cough or when we sneeze, the particle size is large, that is more than what we call 5 microns. They don't travel very far off and very quickly settle onto surfaces. And therefore, the chance of infection occurs only if you're in close contact with someone who's coughing. And that's why we had this issue of a distance of at least 2 meters that should be maintained. But it's being now shown that there are some in these patients who are infectious, there are some of these virus particles maybe less than 5 microns, and therefore they become what we call aerosols, and they can stay in the environment for a much longer period of time. And in a person who is really coughing or sneezing, they could even travel more than the distance that we're talking of, that is 6 meters or 2 feet, and thereby may cause a higher chance of people getting infected, especially in an indoor environment.
You know, which brings me to my next question. How far can these droplets travel in the air, and how long can they stay suspended? It's important because this will really, you know, help people to understand what are the spaces they need to avoid or hold their breath. If that would help, what would you say to them?
So this depends on multiple factors: the environment, what is the temperature, the humidity, and therefore I think it's more important in an indoor environment, especially where there is not good ventilation. So when we're talking of how far they can go, if we have someone who's coughing or sneezing, it can even go more than more than 6 to 9 meters, and it may stay suspended for up to 3 hours. Therefore, it becomes more important that in areas which are closed, there is a good cross ventilation, there is a good transmission or clearing of air, and everyone inside, even in the indoor environment, wears a mask, because that will prevent the spread of these aerosols to a large distance and also not allow them to be in the air for a longer period of time, and will also protect the other person who's wearing a mask, because he will have a lesser chance of inhaling these particles.
All right. I'm going to ask you, a question specifically pertaining to masks, but very quickly, because we're talking about closed spaces. What about office spaces with central air conditioning? What about areas like lifts, staircases, washrooms? Does one need to take extra precautions now?
So in an office where you have an air condition, there are now general policy that is there has to be good air exchange if there is central air conditioning. You should actually, ideally people would say, keep one window or two open so that there is some degree of cross ventilation. So even if you are having a central air conditioner in an office, it may be a good idea to keep a window open so that the air is circulated, and thereby the aerosols which stay in the environment are cleared from the indoor office area that you have. As far as staircases are concerned, again, if you are wearing a mask and you are taking proper precautions, the chances of these aerosol particles being in large number in this environment is less. On the other hand, if you're not wearing a mask and you're not taking all precautions, there is some degree of risk that is there. And that's why wearing a mask, even while you're inside, in an office space, or while you're traveling up a lift or going up a staircase, becomes all the more important when we start looking at aerosol transmission or airborne transmission of COVID-19.
Right. Because you stress so much on masks, Dr. Guleria, are cloth masks helpful? We're seeing a lot of people, switching from, different types of masks or surgical masks to now cloth masks, because given the humidity that many parts of the country are facing, the cloth mask actually feels a lot more comfortable.
So there is a lot of data which has tried to look at this, and it's some sort of a data which goes both ways. But I think there is a large body of data which says that even if you're wearing a cloth mask, it does give you a good amount of protection. And the important thing is that both the person who is infectious and the person who is healthy wear the mask, so that there's protection from both sides rather than only from one unilaterally. And the second issue is that, again, like I mentioned, that there is a good amount of ventilation and social distancing is maintained as much as possible.
So not just masks, but also ventilation and social distancing is what Dr. Guleria is stressing on. An interesting development this week has been walk-in testing, which has been permitted in Mumbai now. You no longer need a prescription to get a COVID test. Do you think it's time that India changes pan-India guidelines on testing?
So I think as our testing capacity has increased to a large extent, we're doing almost more than 2.5 lakh tests a day, more than 1,000 labs which can do the testing, and the capacity is increasing every day. We have to be a little bit more liberal as far as testing is concerned, but keeping in mind that it's not misused, and there are people I know who can afford testing and who have the means to do it, who will get themselves tested every few days just because of a panic reaction. Right. That I think is a waste of testing and waste of resources. So if we are going to open up testing, it has to be done so that it's not exploited and there is equity and people who need it don't get deprived of getting the test done.
Right. Speaking of Mumbai, the Dharavi model is being praised, is being looked at as a huge success model. What can the rest of India learn from Dharavi?
So Dharavi is one area which is very unique in terms of the urban slums. And we have many such areas in large metropolitan cities. And therefore, this model could be very useful in these areas where you have in a very high population density in a small area where there are a large number of people staying in one room, they're sharing a common toilet, or the whole area is sharing a toilet. And therefore, you need to have a separate strategy, which was adopted in Dharavi. And I think that strategy needs to be looked at in a large number of such areas where there are urban slums, because these are unique problems for our country. Yes. You're not going to find solutions in the Western world because such situations don't really exist in that part of the world.
All right, let's look at Delhi, Dr. Guleria. The active cases are falling. Is the peak in Delhi over? Many are asking.
So let's hope so. But I do agree that if you look at the trends over the last, let's say, 7 to 10 days, the number of cases are showing a declining trend. And even if you look at the hospital beds, and I'm talking of even our own hospital, the number of cases who are coming into the hospital have come down. There was a time when we had more than 800 patients admitted who were COVID positive. Now our average is around 450 to 500, and we have therefore beds which are available in the hospital for patients who are there. I have only two other issues that I would like to flag. One is that we need to be cognizant of the fact that we also have a large number of people who are in home isolation, and therefore maybe that could be one factor which could be showing this. The other thing is that it's not a time to become complacent. Right. So very often people feel that now that cases are coming down, we can go out, we can start mixing and having a party. But what we've learned from not only our own country in other cities, but even from the West, that you cannot let your guard down. And even if the cases are coming down and you feel that the peak is coming down, you have to still have all these measures in place in terms of social distancing, even in office, in your workplace, yes, in the market. Because if you don't do that, you will have a resurgence of cases, as has happened not only in cities in India, but globally also.
Absolutely. Let's talk about treatment. Aitolizumab is being used to treat COVID-19 now. It's essentially a drug that's used to treat skin ailments. What more can you tell us about it?
So aitolizumab is basically a drug which is basically what we call an immunomodulator. It is against a drug which is used for skin illness known as psoriasis and has been there in the Indian market for quite some time. There has been some data which shows that it may be useful for the cytokine storm that happens as far as COVID is concerned. And it is an anti-inflammatory drug. It acts against what we call IL-6. And therefore, some studies have shown that it may actually help in decreasing the mortality when it's given in those individuals who have a cytokine storm. There is data actually which has come from Cuba where this drug has been used, which tends to suggest that it may be useful. But as far as all of these drugs are concerned, we have another drug which is also an anti-IL-6 drug which is also available in the market. It's important to understand that when we look at these immunomodulators or anti-inflammatory drugs, these are double-edged swords. Inflammation is a normal body's response to fight an infection. Right. But in COVID-19, in some individuals, they go into an hyperacute stage, which we call the cytokine storm, where the inflammation itself starts causing damage to the lung and to the various tissues, including the lung, and leads to worsening. So in these cases, selective group of cases, one can give anti-inflammatory drugs which try and decrease the inflammation and therefore protect the body from getting more harm by its own inflammatory response syndrome. But it should not be given, because if we give it otherwise, you're impairing the immunity, and there are people who get secondary infection, bacterial pneumonia or fungal pneumonia, which can actually increase the mortality. So it has to be given very carefully. It's not something that you can just give to all patients without looking at a risk-benefit analysis.
All right, very important advice there. I want to, I'll also ask you about the shortage of COVID drugs. We're reporting on black marketing of remdesivir, tocilizumab. Are these drugs in short supply in India? Should we be worried?
So I agree. I think that is happening, and it's unfortunate that there is hoarding occurring. We've had incidents where we have not been able to get it from the supplier, remdesivir, but our patient's attendant has been able to go to the black market and get it for almost 25,000 rupees when it's cost only about 5,000 to 6,000 rupees. So it's unfortunate that even in a time like this, when there is a pandemic, there is hoarding and black marketing going on, which is not the right thing to do. The other thing is that people again need to understand that remdesivir is also a drug which is under emergency use authorization. There is really no mortality benefit that has been shown, and it's useful only in those patients who have moderate to severe disease. That is, in those individuals whose oxygen saturation is really falling, they're requiring higher flow oxygen, or they are having features in the lung of bilateral pneumonia. It's not something that it is indicated or has shown any benefit in mild illness. And because of the fact there's such a lot of hype with this drug, I've had some patients who have started taking it even with mild illness, or even when they've just been diagnosed to have COVID-19. I've had one patient who has actually taken it at home. He's had his private practitioners come and give him the injection at home, although he has only a very mild illness, and decided to start taking remdesivir at home. So I think this is something which we should really discourage. It's not the way the drug has to be used, and it will cause more side effects because it does cause liver damage, it affects the kidney, and we have to be very careful about giving it.
Doctor, there's a new study in which scientists have warned of a potential wave of coronavirus-related brain damage. Which side would you weigh? We spoke about organ damage, last week as well, but specifically brain damage, even in mild cases of the coronavirus.
So we're learning more and more things about COVID-19, and as this coronavirus is we're having more and more cases, we're realizing that it's not something which causes only lung involvement. It causes a lot of systemic involvement. And one of the systems which is involved is also the central nervous system. It can lead to strokes, which we've seen in many of our patients. It can lead to what we call encephalitis. It can lead to a psychotic sort of behavior. And a lot of other type of manifestations are also being seen. So there is now a whole group of neurological manifestations which are being described as part of COVID-19. And I think it's making us more aware of when to suspect COVID-19, even when there is little or no lung involvement.
Right. Monsoons in India, floods as well in several parts. How does that affect the spread of the virus? Does it make it worse?
So again, we need more data as far as this is concerned, because we had initially said that if with summer this should come down. It did not happen. We are worried that with the humidity going up and with monsoon, there may be a higher chance of the virus staying in the air for a longer period, but I don't think we have enough data. The cause of concern for me is that a lot of vector-borne diseases, that is mosquito-related diseases, whether it be dengue, chikungunya or malaria, also present with fever and body aches and chills, which can sometimes be the manifestation also for COVID-19. So it becomes more and more challenging for doctors to differentiate the two, because the treatment is totally different, and you may land up in not diagnosing one or the other because you're not suspecting it. And therefore, I think now with both diseases coming up, we have to have a high index of suspicion for both dengue and for COVID if a person presents with fever.
Another online question: how can one differentiate between a normal flu and coronavirus? The normal flu that comes with a change in season, especially in the monsoons.
So at times, normal flu sometimes may not have fever. You may just have a little bit of sneezing, running nose, and it usually settles in about 3 to 5 days. And if that happens, chances are that you've had normal flu. But as we know that there are a number of patients who have COVID-19 with minimal or no symptoms. So it's always difficult to be 100% sure. But if you have no fever, if you just have a sneezing, running nose which settles in 2 or 3 days, and you've had this in the past during change of season, it's likely to be your allergic problem that has come because of change of season rather than COVID-19. But I do know that a lot of people who have allergic rhinitis, asthma, and that gets worsened during this time actually go into a panic phase because they feel this could be COVID-19.
All right. Very quickly, last question, Doctor. There's been a delay in the start of the clinical trials as far as vaccine in India is concerned. The government now has said that it's going to take up to a year to develop the vaccine. Very quickly, what's the realistic timeline?
So vaccine development is always challenging because, you have a vaccine candidate. In India, there are almost 5 vaccine candidates which are being tried by different companies. The challenge, of course, is to be able to do the phase 1, phase 2 and phase 3 trials in a manner that makes sure that the vaccine is efficacious, it is safe, and then you are able to produce a large amount in a very short period of time. This process itself takes 6 to 9 months. In the past, it used to take years to do. I mean, vaccines used to take 5 to 10 years to come up.
Yes.
Now, because of technology and now because everyone is working together, it's possible that this may be available in the next 6 to 9 months. So in my mind, the vaccine would be available sometime in the first half of next year.
All right. 6 to 9 months is what a realistic time frame looks like. That's all we have time for, I'm afraid. Thank you so much, Dr. Guleria, for joining us.
Thank you very much. Thank you for having me.